first tonight, an update on the coronavirus as the news changes by the minute. Here are the very latest numbers. The Department of State Health Services has the total number of cases in Texas at 23. That number does not include 8 evacuees in isolation right now at the Texas Center for Infectious Disease here in San Antonio. We have also learned that no San Antonio area public schools have canceled classes, but they are continuing to monitor this situation. We have a full list of local universities that are extending their spring breaks and moving to online classes right now at ksat.com. Local hospitals are now limiting visitors, checking them for fevers, and even closing some hospital entrances to try to prevent the spread of COVID-19. Tiffany Huertas checked in with several local healthcare facilities and explains what you should expect if you're headed there anytime soon.
U.S. hospitals are taking steps to make sure there is no spread of the coronavirus, including here at home. Beginning tomorrow morning at 5, University Hospital will begin limiting visitors and closing some hospital entrances. When you enter the hospital, visitors will be screened for symptoms of the COVID-19 virus and exposure or travel to a high-risk area.
We're going to be actually doing some screening questions for visitors who come into our facility to make sure that they themselves don't pose a risk to either patients or staff.
Also, patients may only have 2 visitors per day. Patients and visitors must enter through the main entrance from 5 a.m. to 10 p.m. or the emergency department, which is 24 hours. The shuttles from the garage to the hospital will drop off only at the adult emergency department. The children's emergency department will remain open 24/7. Methodist Healthcare has also implemented visitor restrictions. Last week, Methodist started limiting certain entrances. Their staff has been screening everyone for travel history, fever, or respiratory symptoms. Here's what the Methodist Healthcare System Chief Medical Officer said then about anyone experiencing symptoms.
We're going to ask them to wear a mask when they're inside our facilities.
Baptist Health System will be questioning patients about their recent travel and symptoms once they enter their hospitals. As for visitors, they will also be screened for symptoms and travel before being allowed inside. Starting tomorrow, temperature checks will be done on all visitors before entering the building. They are also limiting the number of visitors allowed. For the 9, Tiffany Huertas.
Now, if you think you have COVID-19, University Health System says the first thing to do is to call your primary care provider. Sometimes they might not ask you to come to their facility and they can provide guidance. If someone has an inquiry, you can call the Metro Health COVID-19 hotline. That number is 210-207-5779. Myra?
Thanks, Tiffany.